Dr Indra. Today I'm speaking to Dr Louise Oliver. She's a colleague that I've recently met who's talked all about breathwork, and more we're finding that breathwork is going to be really important for patients' health. Hi Louise, thank you so much for being here today. Would you like to tell us a little bit more about how you got here? I've heard your story and it's so fascinating. So tell us a little bit more and then we can talk a little bit about why I think breathwork is kind of really important for my patients moving forward.
So it was really random. In 2019 I just decided to learn a little bit more about mindfulness, and then I went on this really unstructured, unplanned journey that learned how the mind and the body are sort of so connected. And then along that journey then I became a perimenopausal snorer, and it massively affected my sleep and also the quality of sleep of my husband. And I didn't really think there was much I could do about that. But then I recognised I wasn't breathing efficiently, and then essentially I corrected how I was breathing, and then my snoring stopped. I was sleeping so much better, obviously my husband's sleeping better, and actually as an added bonus to that I felt calmer and I could exercise with greater ease. So I thought, well, why does everyone not know about that? So I worked sort of half-time as a GP but half-time as a breathing practitioner now.
Amazing. So let's get into the breathwork kind of thing. So one of the things that we do is we kind of listen to our chest and look at our oxygen saturations and our peak flow, and we're finding that more and more people are not probably breathing very well. So can you tell us kind of what are the signs that you notice, other than obviously something like you said, the snoring, that people need to be aware of if their breath work isn't as good as they could be?
So I suppose it's the first, just having the concept initially that I used to think you were either breathing or you weren't breathing, but actually there's like a spectrum of breathing efficiency. So we can breathe efficiently or inefficiently or anywhere in between. And obviously when I went through my perimenopause, I slipped down that, and that's when I started snoring. So first of all, it's just having that concept that am I breathing as efficiently as I could do? And because in this modern day world we're not necessarily living as we've been biologically programmed to live, we're not necessarily breathing as we've been biologically programmed to breathe. So this is why, you think, well, everyone should know how to breathe.
Yeah, that's what I was going to say. Isn't that something that we should do naturally? Why are you not breathing optimally?
Exactly, but it's just because of the changes in modern day world, and there's lots of different aspects to that, but it makes it more likely we're not going to breathe as efficiently. And also if you've got certain medical problems, some of those things can make it more likely as well. So how can you assess it? Well, we know it exists, but we don't actually have a sort of gold standard method of assessment, which is such a shame. I think the scientists are actually working on that, but we don't at the moment. So my thoughts on it are just very simply, just observe how you breathe just notice how you breathe over the next week, 2 weeks. Essentially the mouth has no role in breathing. So essentially we've been given a nose, and that nose has been completely designed to breathe. When a baby comes into this world, it nasal breathes. So that is how our body has been entirely set up. Yes, we can mouth breathe, but our body then has to make up lots of changes, or has to cope with breathing differently, and sometimes that can lead to some symptoms that can be quite surprising. So I would just say, just check in with your breathing over the next week or 2 weeks. How much are you using your mouth to breathe? So when you're at rest, when you're moving, you're walking to the car, going upstairs, and when you're sleeping, are you waking up with a nasal congestion? Are you waking up with a dry mouth? Have you got a lot of saliva on your pillow? All these things are suggesting that you're breathing with your mouth open. And the mouth, literally, the only role it has in breathing is making your breathing inefficient. So that's
it.
So that's an easy way of working it out. Then the other thing is how we breathe when we're asleep. So obviously when we're asleep, that's our unconscious breathing pattern. So you get feedback. So it might be you can ask your sleeping partner, what's your breathing like? It may be that you want to use some sort of snoring app to just can listen and assess how much. But essentially, if you're using the mouth to breathe when you're asleep, you're snoring, you've got noisy breathing, you've got pauses or gaps in your breathing, again, that's suggesting your breathing's not so efficient. And then there is a third way that you can test it. You could do it with a comfortable breath hold time.
Oh, okay, yeah.
So that's quite, nothing's perfect in life, but it's quite good.
Yeah.
So essentially what you can do is you need to be doing, ideally you do it after you wake up, before you've eaten, because then nothing's interfered with your breathing. You've been sort of rested for, a period of time before. And all you do is you just obviously have some sort of clock, so maybe the clock on your phone, able to time in seconds, and you're just going to keep your mouth closed, breathe in, breathe out, and then pinch and hold your nose, and you just relax into it, and you press start on the timer when you pinch your nose. So I'll just say that again: breathe in, breathe out, pinch and hold, press go. And then you just relax into it. So we've got enough oxygen in our lungs to cope with the breath hold of this. Your oxygen generally won't drop. What happens is you've stopped your waste products leaving your body, so you've stopped your carbon dioxide coming out. And that will rise up, and when it hits your personal tolerance, your body will send a signal to breathe. Different people feel it differently. Commonly it would be like a spasm in your neck, commonly it would be a spasm under here, and that's your body literally jolting you to breathe. It's not a maximum breath hold, because ego skews the result. We're not interested in that. We're interested when your body sends a signal to breathe. So when you let go, generally the breathing's fairly calm, because it's just when your body sends the first signal. For really good, if it's less than 25 seconds, there's potential there that you're not as efficient as it could be. For really good breathing, ideally about 40 seconds. So.
Okay.
So those are sort of 3 different ways really of assessing it.
So that's good. So what kind of symptoms, other than the ones you've just mentioned, what the impact, like you said, it impacted on your fatigue and energy level. So what sort of symptoms are people kind of need to be aware of?
So there can be so many different symptoms. It's really unbelievable.
Kind of affects the whole spectrum.
Yeah. I mean, the first one I would say is, I'm very passionate about sleep, because obviously when we sleep, as you know, that's when our body, yes, we relax, but actually that's when our body completely repairs itself, doesn't it? And it's a very active process. And what I think people don't realise is, if we don't breathe efficiently when we're asleep, it interferes with that process. So essentially, if we have noisy breathing, gaps in breathing when we're asleep, our body is more prioritising breathing, or it feels a bit more in a fight-flight response. It feels like there's some sort of threat. Doesn't realise that it was me snoring. It thinks, oh, it's a tiger and it's just me snoring. But it puts us more in that fight-flight zone when we're asleep, and we don't want that. We want that fight-flight
to be nice and
calm. Exactly.
So would that be sort of, because I hear a lot with my patients as well, that they wake up feeling tired, they don't feel refreshed, even though they may be sleeping for 8 hours, maybe kind of struggling as well to go to sleep. Yeah. These kind of things, are they sort of things that people need to be aware of?
Completely.
They may not have a partner to know how their sleeping is, but if that's how they're waking up, if they're feeling tired when they're waking up, they've obviously not had an efficient.
Yeah, exactly. So if you've had a decent amount of sleep and you're waking up unrefreshed, obviously there can be different reasons for that.
Yeah.
But certainly one I would say is, consider how you breathe when you're asleep, because if you're not breathing efficiently when you're asleep, then it interferes with your sleep quality. And you can change. If you improve how you breathe when you're awake over time, and it does take time. It's an active, not passive process. Over time, that your unconscious breathing pattern becomes more efficient, and then you breathe more efficiently. People can wake up with, commonly, it's really common, particularly in women, they often don't go to the doctor and say, oh, I'm snoring, or I've got gaps in breathing. What they'll say is fatigue, nightmare, they're waking up with panic attacks, they've got morning headaches, just exhaustion. Those are the common things that they complain of. One thing that obviously people can wake up with panic and palpitations at night, but sometimes you've got to think, is it actually that person's airway has got so narrow that the body's sort of generated a fight-flight response to open that airway to get that person to breathe again? And actually, it's not that they've got anxiety or palpitations related to anxiety. It is actually they're not breathing efficiently. All sorts of things can happen from symptoms because you're not using the nose to breathe. The nose, if you don't use the nose, it's a use it and lose it organ. So basically, if you're not using it, you get more congested in your nose.
Oh, right. So those that are sort of sinusy congested, we actually have, because they'll always say, well, I can't because I'm so bunged up, but actually it's the kind of, which came first?
Exactly.
Chicken and egg.
Yeah, completely. And so only rarely have I not been able to re-establish nasal breathing with someone, even in people who said, oh, I've had a rugby injury when I was young, there's no way I can run with nasal breathing because I've got this septal deviation or whatever. And often it's to do with, it's this feedback loop. So we've got tissue in our nose, so called turbinates, that can swell up with blood, and essentially if we're not using the nose to breathe, those swell up, but obviously we start to use it again, those go down, and that can affect the ability to smell. I've had someone who couldn't smell for 18 years but was told never smell again, and she corrected how she could breathe and she could smell the bolognese on the phone. She didn't recognise the smell. So it can, and a lot of people, if you're mouth breathing, that can lead to pain because you're using the wrong muscles. You start to use more neck muscles and it pulls, and so it can cause pain. We're connected from our mouth right down to our toes, so you can actually get more likely to get pelvic pain, back pain,
and all your core and how your back. That's why the core, because your diaphragm is part of the whole breath work, isn't it?
Yeah, exactly. So the diaphragm should move, so that's this muscle that's under here, it should move as we breathe, but when we're mouth breathing we move the diaphragm less, so that can lead to stiffness in other parts of the core, so that can be the pelvic floor, the spinal muscles at the back, or even in the abdominal muscles. So it can lead to some really sort of unusual symptoms, and
all the way from top to toe.
And again, you can have even symptoms such as pins and needles and muscle spasms and breathlessness with exercise. So there's so many different symptoms that can come.
Amazing. So we've talked about why this is happening and how it impacts us. So what are your sort of top tips for people in terms of how they can make the changes? Is there anything that's very easy for you to talk about, or is it, obviously coming to see you and working with you will be useful, but is there anything that people can start to do anyway?
Well, I think I always the 3 A's approach. I always think aware, assess, and action. So obviously, first of all, you need to be aware of it, which hopefully we've raised awareness today. Assess, so we've given you some tools to do that, and then action. So breathing is actually really complicated. And I used to think it just happened, but actually it's really complicated. So different people can breathe inefficiently in different ways. So obviously, then it just depends. But the simplest thing is trying to make sure you're nasal breathing as best you can. Good posture. You need good posture to breathe well. And I would say don't be afraid of air hunger. So if I said to somebody now, I'd like to go for a walk, and I'd like to go for a walk fast enough, I'd like to go for a walk but maintain nasal breathing, they would probably say at some point, I feel suffocated, or I feel I'm not getting enough air in, or I want to take a big breath in through my mouth. And I describe that's air hunger. So you're feeling that
you're trying to.
You need to take that breath in, and actually more often than not, it's not due to a drop in oxygen level. That's due to the fact that when you hit your carbon dioxide tolerance, and someone knowing that can be very powerful, because then they're like, oh, okay, so I'm feeling air hunger now. It's not my oxygen that's dropped; it's my carbon dioxide level that's gone up, and I'm just a bit intolerant to that. But I can train that. So now I'm going to go from a walk, and when I hit that feeling of suffocation, I'm either going to stop or I'll just slow down and I'll just try and go with it, and then I'll carry on. And it might be when you're first doing your walk, you're stopping a lot, and that's fine. But you've got to see that you're training your body to do more with less. And then over time, and it takes time, I'd say give yourself 6 or 8 weeks or something, you'll find that it just becomes easier. Now, obviously, I have people at the other extreme that I've had some people where just by getting their mouth closed they can experience air hunger, and obviously they won't be able to do that, so then we need to do much gentler exercises at rest to do that.
How is this connected with nitric oxide? Because there is that connection that I think you take and you're also trained in that technique as well. Can you kind of give us a little bit of an explanation with that, relating to that?
So nitric oxide in the environment is terrible.
Yeah. But we need it here.
In our body it's wonderful.
Yeah.
And it's only been discovered, I think it was in 1992.
Really?
It was the molecule of the year. It was either 1992 or 1993, I can't remember. But we create more nitric oxide, lots of nitric oxide in our sinuses and in our nose, and the figure I've heard quoted is when we nasal breathe, we take 6 times as much nitric oxide from our sinuses and nose into our body compared from if we mouth breathe. And nitric oxide helps open up blood vessels, it helps open up airways, it has a sterilising effect, so it's like antibacterial, antiviral, etc. So it's really, we want to get more of that in our body because it's a positive thing, but we're going to do more of that if we nasal breathe.
So that's the connection with the nasal breathing.
Yeah. So the first exercise I'm going to show you is something called small breath holds, and this is a really lovely, gentle exercise. So it's suitable for absolutely everybody, and in particular people with a really low comfortable breath hold time. We will change it, so what I'll do is I'll just start off with a very small breath hold, and then I'll increase it up, and Dr Indra is going to demonstrate it for you. So when people are breathing really quite inefficiently, if I'm asking them to slow down their breathing, it's actually really hard to slow down, because just by saying to someone, slow down how fast you're breathing, they can't do it. Their natural breathing pattern is fast. So we can slow that down by adding in a pause. So I will ask that you keep your mouth closed throughout this exercise if possible, and you take a gentle breath in through your nose, gentle breath out through your nose, and pinch and hold. And you can hold anywhere between 1 to 5 seconds. So if your comfortable breath hold time is really quite low, just start by holding 1 second. And then I'll increase it as we go along. When you let go, you breathe in and out normally for 2 to 3 breaths, and then you repeat the process. Just keep repeating that. The exercise should not cause any distress at all. So if by holding you're feeling tense, you're getting muscle spasm in your neck or your diaphragm, you're holding too long, just hold for less. Okay. So if you keep your lips sealed throughout, gentle breath in through your nose, gentle breath out through your nose, pinch and just hold for 1, and then let go, and you're breathing in, let go, and just breathe in and out of your nose. Just breathe in, just normally in and out of your nose for 2 or 3 breaths. Just 2 or 3 breaths, that's it. And then when you're ready, gentle breath in, gentle breath out, pinch and hold, and we'll hold for 2, 1, let go, and breathing in and out of your nose. So just 2 or 3, just normal breaths, nothing fancy in between. That's it. And when you're ready, gentle breath in through your nose, gentle breath out through your nose, pinch and hold for 3, 2, 1, let go, breathing in and out of your nose. If you're comfortable, you can soften your gaze or close your eyes. Just normal breathing in between. And when you're ready, gentle breath in through the nose, gentle breath out through the nose, pinch and hold. We'll hold for 4, 3, 2, 1, let go, breathing in and out of the nose. Just 2 or 3 normal breaths in between. If at any point it's stressful, don't hold for as long, you let go. When you're ready, gentle breath in through your nose, gentle breath out through your nose, pinch and hold. And we'll hold for 5, 4, 3, 2, 1, let go, breathing in and out of your nose. Just 2 or 3 normal breaths in between. The next exercise I'm going to explain is something called breathe light, hands on chest and tummy, or you can actually have your hands on your lap if you prefer. So you can have one hand on your chest and one hand on your tummy, or both hands in your lap. Or if you're in a supermarket queue, don't bother with your hands at all, just, it doesn't matter. And essentially what you're doing with this exercise is you're going to ideally have your mouth closed to get your lips sealed. And if you imagine at the beginning of the exercise, you might be breathing like this. The idea is we're slowing and softening down your breathing. So we're just making your breathing slower and gentler. And ideally to the point where you feel a little bit of comfortable air hunger. So you're slowing down and softening your breathing, not by restricting your breathing, it's just slowing down and softening your breathing to the point where you feel a little bit like you'd like to take a bigger breath, or you'd like to breathe through your mouth, or you're feeling a tiny bit sort of suffocated, but not enough to cause any distress at all. If it causes any distress, you just stop the exercise, breathe normally if you can in and out of your nose, give yourself 15 seconds rest or so, and then come back in. And then this can just be practiced, and it can just help improve carbon dioxide tolerance, but it also makes you feel calmer. So Dr Indra is going to demonstrate. So we always want to make sure we breathe right, good posture so we can breathe right. So just imagine as if you've got a little string pulling you up on the back, you've got your lips sealed, you're not tensing your face, and if you're comfortable, close your eyes or soften your gaze, and just bring an awareness to your breathing. So feel that slightly colder air as it comes into your nostrils, and that slightly warmer air as it leaves your nostrils. And can you now start to soften and slow down your breathing? So imagining those fine hairs in your nostrils. Can you breathe so softly and so gently that those hairs in your nostrils hardly move? So you're not restricting your breathing, you're not tensing your breathing, you're just slowing down and softening your breathing. So the third exercise, so this would be more suitable for somebody probably who's got a comfortable breath hold time, probably over 20 seconds. By all means, you can have a go if you've got a lower control, a lower comfortable breath hold time, but it may be you're not ready for this, so it just depends. I would say go for a walk. Make sure that you are walking with a good posture. So imagine that you've got that string sort of pulling you up from the back of your head, and you're just going for a walk. You've got your lips sealed and your nasal breathing, so you're just breathing in and out of your nose. And then the aim of the exercise is to maintain nasal breathing whilst you're walking, and ideally having a little bit of air hunger whilst you're doing it, because then if you're walking with a little bit of a comfortable air hunger, so that feeling of you're not quite getting enough air in, or you'd like to take a breath through your mouth, you know that you're training your body to be more tolerant to carbon dioxide. So, but we don't want to cause any distress at all. So if at any point that air hunger, that feeling of suffocation gets too much, just slow down and stop. So you're going for your walk, you've got good posture, your lips are sealed, and your nasal breathing. So it might be that you live in a hilly area, so you're going to try and walk up the hill whilst maintaining nasal breathing. Or if you haven't got a hilly area, you might just want to walk fast enough that you are getting an element of air hunger. Or if you've got mobility problems, you can't walk up a hill or walk fast, then you're in charge of slowing down your breathing. So if you imagine if you're breathing like this at the beginning, have a go at just seeing if you can just slowing down the breathing to the point where you just feel that you're not quite getting enough air in, and just try and sit with that comfortably or walk with it comfortably. If at some point it becomes too much and that feeling of suffocation is too much and you want to mouth breathe, I would recommend just stopping or slowing down, letting it pass, and then go again. And slowly over time, if you keep doing that, you will find that your body just develops this brilliant ability to be able to exercise and walk whilst maintaining nasal breathing, because you've improved your carbon dioxide tolerance.